But I am Juan Farias. I work with an agency called Vibrant USA. Okay, we're a Medicare insurance specialist. We're not an insurer. We're not a carrier. We are an agency. And what I'm going to do today, I'm just going to go ahead and educate you guys on what Medicare is, how it works, the steps to enrolling on Medicare. We're not doing any selling at all today. It's more of just an educational based seminar. Um, I'm going to go ahead and go through the slides. It's about 37 slides. I'm going to go hopefully not too fast for you guys. Write some notes, and then at the very end, we'll go ahead and hold any questions you may have, and then you can certainly ask me all your questions. Okay. So let's go ahead and go ahead and get started. So Medicare Basics 2021 here, first page here. As we continue on slide 2, we're going to go ahead and talk about our agenda. Who is Vibrant USA? We'll talk about Medicare Parts A and B, optional Medicare plan types, next steps, and resources and contact numbers that I'll provide to you guys for your information as well. Slide number 3, you guys. So who's Vibrant USA? We always get calls of people saying, I want Vibrant USA insurance, and we're actually just an independent insurance agency. That's who we are, an independent insurance agency. Okay. We started serving the public in 2003. We have over 20,000 active customers, and really we specialize in Medicare insurance. We're contracted with 50 or more plans, and we're unbiased service. So we're unbiased, meaning we can sell any policy to somebody who's on Medicare. And we're very proud of that number of over 20,000 clients. About 98% of those is probably Medicare recipients. So where we have an office, we started up in Bellingham, Washington. I'm originally from Washington State myself. We have an office in Linden, which is about 30 miles from the Canadian border. Then we have an office in Everett, outskirts of Seattle. And then we also have one in Vancouver. And then me, myself, I'm here in Texas. Where I'm at, I'm on Highway 281 next to Boverde Hills Veterinary Clinic, right before you get to 1863. So that is where I'm at. I'm here in Boverde. All right, you guys, next page, slide number 4. So here's why you're here. Who is eligible? Who is eligible for Medicare? And there's a few ways you can get Medicare. People age 65 or older who are U.S. citizens or permanent U.S. residents living in the U.S. for the past 5 years. Excuse me. People under 65 with end-stage renal disease, also known as ESRD, permanent kidney failure requiring dialysis or kidney transplant. So somebody does not have to be 65. Usually, yes, you do get Medicare when you're 65, but in certain conditions, you don't have to be age 65. Another way you can get Medicare is people under 65 with also called LAS, or often referred as Lou Gehrig's disease. And then lastly, people under 65 with disabilities. If you've had a disability for over 24 months of receiving Social Security disability income. So I have clients who are in their 30s and 40s, 50s, and that's because they don't have a disease, but they do have another disability, and they've been on disability for 24 months. So right there, that automatically qualifies you typically for Medicare. On the right side here, you can see the new Medicare card. These have been introduced and been in place for about, I think, 2 years, if I'm not mistaken. But that is how your Medicare card looks like. Okay. Your Medicare claim number is no longer your Social Security number. Back in the day, the old cards, that's how they classified your claim number as your social. But Medicare went in there and corrected that just because of protection. And now it's just a numerical phase in numbers. So that is the new Medicare card. Next page, you guys. So slide number 5 here, we're going to talk about your Medicare Basics. We'll talk about Medicare Part A, which is your hospital insurance. Medical Part B, which is your medical insurance. Your A and B give you your original Medicare, or also known as your traditional Medicare. Then we have optional types. We'll talk about Medicare Plan C, Medicare Advantage plans, Part D prescription drug coverage, And then Medicare supplement insurance, also known as Medigap insurance. And again, those are all three of those are completely optional. Okay. Next slide, number 6 here. Medicare Part A. So what is Medicare Part A? So you usually don't pay a monthly premium for Part A as long as you or your spouse have worked 40 quarters. So very important, 40 quarters, or also known as 10 years or more in the US and paid Medicare taxes. So to get your Medicare Part A, as you can see, it's generally free. You don't pay for it. It's included by you working into the system 10 years. Okay. Very, very rare that somebody has to buy Part A. And if they have to buy Part A, that just means that that individual has not worked enough credits into the Medicare system and they have to buy A. Very rare. I don't run into a lot of those folks. But if it does happen and you have to buy it, it means that you've worked less than 40 quarters and you got to pay about $471 per month for Part A premium. Um, some people pay a higher premium if they don't enroll when they're first eligible. But typically, about 98%, 99% of folks don't have to pay for their Medicare A. Some folks do, but that's a very rare circumstance. Okay. Next slide. Okay, so what is Part A? What does it cover? Under Part A, as you can see, it covers inpatient care in the hospitals, skilled nursing facility, also known as SNF, home health care, and hospice is all under Part A. Okay. Some limitations here. Skilled nursing is only covered after a hospital stay of 3 days and is not covered beyond 100 days per benefit period. Hospital stay coverage is limited to 150 days. Days 1 through 90 reset after a benefit period. Days 91 through 150 are only covered once in a lifetime. And benefit period begins when you enter a hospital or skilled nursing facility and ends after 60 consecutive days out of the hospital or skilled nursing facility. Here on the next slide, we're going to go ahead and see cost. As you can understand, Medicare Part A and hospitalization is not free. You will have to pay some cost if you only have traditional Medicare or no other insurance. But here on the next slide, we'll talk about the cost here. So, Part A cost. So first 60 days, if somebody goes into the hospital and they have no other insurance and they just have traditional Medicare, your first 60 days, you got to pay a deductible. That's $1,484. And that's what you, the member, would pay. If you're still in there, days 61 through 90, you would pay $371 per day. Days 91 through 150, somebody's going to pay $742 per day, and that's using their 60 lifetime reserve days in the hospital. Okay. Again, those are costs that you, the member, would pay if you have no other insurance and you have what is called just your traditional Medicare. Next bullet point here is your skilled nursing facility. Excuse me. After it requires a 3-day hospital stay. Okay. But the first 20 days, Medicare says, hey, we'll cover it to 100%. So first 20 days, got 100% coverage. Days 21 through 100, the member would pay $185.50 per day, and they only give you up to 100 days consecutively for skilled nursing facility. Hospice end-of-life care is covered at 100% and billed under Medicare A. And home health care, medically necessary skilled care services covered at 100% as well, also billed under Medicare A. Next slide, you guys. Okay, so now we're going to go ahead and talk about Medicare Part B. We talked about Medicare A, how it works, if you pay anything, what you pay. Now we're going to go ahead and talk about Medicare Part B. Okay. So Medicare enrollment and premium is handled through Social Security. So to get it, you got to go through Social Security. You have a 7-month window around your 65th birthday to get your Medicare B, 3 months prior your birthday, and then 3 months post your birthday month. So technically 7 months, 3 months before the month of your birthday, and then 3 months after to get your Medicare B. If, and it does happen, if your enrollment window is missed, if somebody doesn't just check their mail, they forgot they're enrolling in Medicare, or maybe they're just traveling. But if you miss your enrollment window, you may enroll within a general enrollment period. So Medicare says, okay, we understand that there's circumstances. We'll allow you to get your Medicare during January 1st to March 31st, but it's not going to start until July 1st. Okay. Now, a lot of folks do work past 65. You can defer your Medicare Part B if covered by a credible employer plan. So if you're still working, you could say, you know what, I don't want to enroll in Medicare. I have company insurance. It's really good. I don't want to deal with Medicare just yet. You can go ahead and defer your Medicare B. Then when you retire, then you can get your Medicare B. Okay. All right. So next page, you guys, page 10. What Medicare beneficiaries pay. Monthly premium is based on income and is directly deducted from Social Security. If you're not claiming Social Security income, you can receive a quarterly bill or pay monthly via EFT. That right there, your premium again is based. Everybody pays for Medicare. It is based on income. If you're collecting Social Security, the government will automatically deduct your Medicare Part B premium. Okay. If you're not collecting Social Security, they can send you a quarterly bill for 3 months, and then you send them a check to pay for your Medicare B. Now, some people will pay more for Medicare Part B based on modified and adjusted gross income as reported to their taxes from 2 years ago. So what that is saying, basically, if you have a high income, unfortunately, Uncle Sam's going to come in there and charge you more for your Medicare Part B. Okay. Here on the next slide is what you'll pay. Typically, most folks, about 90% of my clients pay the standard B premium for 2021, which is $148.50. Okay. And as you can see, it does discuss your income. As you can see, if you file individual tax return, there's a dollar amount right there. If you file joint with a spouse, that's the dollar amount right there to be paying $148.50. Now, as you can see, if you have a higher income, unfortunately, Uncle Sam's going to have his fingers stuck in that pot, and they're going to want to charge you more for Medicare Part B premium. But again, most of my clients pay the standard premium of $148.50. And as you can see, if you have a high income, you will pay more for Medicare Part B. But most folks just pay $148.50. Okay. Next slide, you guys. So slide 12, Medicare Part B. What does it cover? So under Medicare Part B, you have your physician services and outpatient care, durable medical equipment, preventative services, physical therapy, and physician administered drugs. Okay. Limitations: covers glasses only after cataract surgery. No coverage for custodial care. No coverage outside of the United States. Providers must be accepting new Medicare patients. And it does not cover routine hearing or vision, glasses or hearing aids, alternative health care like naturopathic. It doesn't cover routine chiropractic care, prescription drugs, or dental. Okay. Next slide, you guys. Page 13 here. So Medicare Part B cost. So you have a deductibles, and then you also have co-insurance. So the first thing is you have a $203 annual deductible. After that, Medicare pays 80%. So 20% co-insurance on Medicare approved medically necessary services. And thereafter, Medicare then pays 80% of assignments, and the beneficiary is responsible for the remaining 20% plus any deductible. If a provider does not accept assignment, they can bill you up to 15% or more. There is no maximum out of pocket. The member cost share 20% plus deductibles or co-insurance. So very, very simple, you guys. Right there, Medicare says, hey, we'll cover we'll cover 80% of the bill. You got to pay a deductible, and you got to pay the remaining balance of 20%. Okay. So just with Medicare, if you have no other insurance, Medicare will only cover 80% of if they accept assignment, meaning they accept the bill and the coverage for Medicare. And then you, the member, is stuck with 20%. And again, remember, this is only if you have just traditional Medicare, no other insurance. All right, so next page, page 14. So real quickly, if you're not retiring, you can decline your Medicare Part B if you're covered under an employer plan, but you should verify with your employers as they may require you to join a Medicare-related plan. There is no penalty to enroll in Medicare Part B after age 65 if you're covered under your employer or group plan and enroll within 8 months of loss of coverage. Okay. So again, if you're still working, you can defer your Medicare Part B. Just double check with your employer. And then you have about 8 months to get your Medicare insurance without a penalty. Okay. So next page, 15, page 15. So now we're going to go ahead and we talked about Medicare, traditional Medicare A and B. We spoke about coverage and cost of Medicare A and also same coverage for Medicare Part B. Now we're going to talk about options. This is an option as well. So somebody who says, hey, you know what, I want better protection. I want something that's going to cover me because Medicare obviously does not pay for everything. Medigap is an option. Medigap are also known as a supplement. Okay. They're sold by private insurance companies since 1965. It works as a secondary insurance. Plan pays after Medicare pays first. It only works with original Medicare. Medigap plans cannot be combined with what is called a Medicare Advantage plan. Only pays if Medicare approves the bill and pays first. Does not currently include prescription drugs. So prescription drug coverage must be purchased separately if desired. Requires no underwriting when enrolling within 6 months of turning 65. Okay. And that's a supplement plan. And we're going to go into a little bit more detail here in the next page. So supplement plans designs range in options from plan A through plan N. Plan designs are standardized. All must be exactly the same. For health coverage, only the premium may vary. Prescription drug coverage is not included in plans sold after January 1st, 2006. Medicare pays for the Medicare eligible benefits. Then Medicare supplement pays patient's portion depending on plan option that you choose. Some Medicare supplement also pay for some benefits not covered by original Medicare, like travel. Next slide, you guys. So, Medigap, what's covered? Typically, what we sell the most and what people seek the most is either a Plan F or a Plan G. Folks who have been on Medicare can get a Plan F. If you're barely enrolling in a Plan F or barely enrolling on Medicare for the first time this year, you are not able to get a Plan F. Medigap C and F high deductible Fs are no longer sold to individuals turning 65 after January 1st, 2020. Okay. So the next option, most folks really like a Plan G. As you can see on the diagram, Plan G, as in George, covers everything that Medicare does not pay. The only thing that if somebody enrolls in a Plan G, the only thing that they have to pay is the premium and the Part B deductible, so which is about $203, if I believe correct. So you got to pay that deductible. Then typically your Plan G picks up the remaining gaps and the member has no copays. Okay. So that's a supplement plan, you guys. Next page, we'll talk about Medicare Advantage plan. So we talked about a supplement plan. Now we're going to go ahead and talk about what is a Medicare Advantage plan, or also known as a Part C. And these Medicare Advantage plans are offered by private insurance companies approved by Medicare. They bundle Medicare Part A and Part B of Medicare to create Part C. Part C plans cover everything Medicare covers, but can add additional benefits. Added benefits include vision, dental, hearing, fitness programs, and prescription drug coverage. So somebody could say, hey, I don't want a Medigap plan. I'd rather go with the Medicare Advantage plan. Both of those are options for you. Plans are different for everybody. Everybody's needs are different. Somebody could say, you know what, a supplement plan is perfectly fine for me. I want that one. Or somebody could say, hey, you know what? A Medicare Advantage would be a good fit. I want to consider a Medicare Advantage. Okay. Next page. Medicare Advantage plan eligibility. You got to live in the plan service area. You got to be enrolled in Medicare A and B. Lots of times I have somebody say, Juan, can I get this Medicare Advantage plan that's in Houston? I have a cousin in Houston. She really likes your plan. It's $0 a month. It's awesome. I want that exact same plan. My answer is, unfortunately, Mrs. Smith, you cannot get that plan. You have to get a policy that's available in your service area, basically in your county of residence. If you move to Houston, you can get a plan there. But since you're here in Bexar County or Comal County, you gotta get a Comal County specific policy. Okay. So you can enroll in your plan based on the service area where you live. And you have to have your Medicare A and B. So next slide, number 20, Medicare Advantage plans. You must continue to pay your Medicare Part B premium. So a lot of times, a lot of folks think that you can stop paying your B premium. That's incorrect. You always have to pay it unless it's paid by Medicaid. The state of Texas could pay for your Medicare Part B, but that's a different circumstance. That's Medicaid, not Medicare. Typically, everybody has to pay their Medicare Part B premium. If you have a Medicare Advantage plan, the provider bills the Medicare Advantage plan, not Medicare. So you don't lose your Medicare. You're never losing it. But if you decide to go with the Medicare Advantage plan, the provider is billing the carrier and not Medicare. Most Medicare Advantage plans, the provider must be contracted with the plan and considered in network. Okay. Again, so the provider has to be contracted and considered in network for you to have coverage. Plan premiums and your cost share will vary by carrier and location and may change year to year. Plans are renewable as long as you pay your premium and the plan remains in the service area. Membership is not contingent on your health. So I get that question a lot. Juan, I had a bad health year. Unfortunately, I probably the carrier racked in maybe $1 million medical bill. Is my carrier going to drop me? No, the answer is no. They cannot drop you. They're not, as long as you pay the premium if it has a premium. And if the plan continues to be available in your area, you will continue to have coverage. Okay. Next slide, page 21. Common Medicare Advantage types. It says Washington, but I apologize. Same thing for Texas here. We have an HMO, Health Maintenance Organization. Beneficiaries can generally only go to doctor specialists or hospitals that are part of the plan's network. Referrals are usually required except in an emergency situation. So an HMO, it typically means there's a gatekeeper, there's a doctor, he coordinates your care, he tells you where to go. And the only time that does not apply is if it's an emergency. Then we have a PPO, Preferred Provider Organization, usually network of providers, but beneficiaries may use out-of-network providers, usually at a higher cost. Referrals are not required, but prior authorizations may still be needed. So a PPO will give somebody a little bit more freedom, more flexibility. You can go in and out of networks. You go to out of network, obviously the cost is going to be higher just because you're seeing a non-contracted out of network doctor. But a PPO does give you more flexibility and freedom. S&P plans, special needs plans, usually an HMO type plan. Membership is limited to certain groups of beneficiaries with chronic or disabling conditions, those eligible for Medicaid. Remember, Medicare and Medicaid are different. Medicaid is based on income or those living in institutions. So that's an S&P plan. Most common Medicare Advantage plans, you guys, are definitely an HMO or a PPO, but those are the most common plans that people seek or know. Next slide, page 22. Prescription drug plans, drug or Part D plans. Prescription drugs at a retail pharmacy, okay? Benefits must be equal to or better than a base plan modeled by designed by Medicare. Not included are drugs not on the formulary. Formulary is a list of covered medicines. Drugs excluded from coverage by Medicare, over-the-counter medications, medications purchased outside the U.S. Some notes: Medicare Part D plan began in 2006, only offered by private insurance companies approved by Medicare. Coverage options may vary by insurer and plan type. Part D is voluntary. I would kind of make sure you understand that. It is voluntary. The government doesn't make you get a Part D plan. But as you can see, my next bullet point, 1% penalty every month without drug coverage if you choose to enroll in the future. So what that is saying, the government says you don't have to get a Part D plan, but there is a penalty, and that's a financial penalty. They will charge you 1% of the average premium, which is about $35, $36 if you don't have a Part D plan. Okay. Slide 23. So, Part D standard benefit, Medicare benefit design. First stage, you have a deductible. Member pays 100% until the deductible is met. Okay, the deductible on the prescription drug plan here is $445. So it can be higher than $445. It can be lower, but the highest Medicare says that a Part D plan can charge a beneficiary is $445. That's a deductible. Not all plans have a deductible. Okay, there is some plans that do cover a deductible at 100%, but most of them do have a coverage deductible of $445. Then you have your initial coverage period. Member pays portion of the drug cost until the total of what the plan and the patient pays equals $4,130. Here's where it gets a little bit confusing here. You have a donut hole, a coverage gap. What does that mean? Member pays approximately 25% of generic and name brand medications until what they have paid in true out-of-pocket troop amounts to a total of $6,550. The next phase is your catastrophic coverage. Member pays a maximum of 5% or a small copayment until the end of the year above $6,550. And then the final stage, new plan year begins for 2021. Okay. 24, slide 24. Part D drug tiers. Okay. Generally, plans have a formulary process in which they determine tier and classification of drug. The lower the tier, the lower cost to the member. So, tier 1 is typically called a preferred generic drug. Tier 2 is a non-preferred generic drug. Tier 3, preferred brand drug name. Tier 4 is non-preferred drug. And Tier 5, specialty drug. So, lower the tier, the lower cost to you, the member. Tier 1, you're not going to pay much, maybe $0, maybe $2. As you keep going high, tier 3 is a mid tier. So your medicine's going to be probably about $40 is my guess, depends on your plan. And as you can see, if you get to tier 4 and 5, meds are a little bit more expensive at that classification of tier. Next slide, slide 25, Part D coverage options. So how do you get your Part D? You can have it as a standalone prescription drug plan, PDP. It can be added to original Medicare or a supplement plan, remember, also known as a Medigap plan. It can be bundled into a Medicare Advantage plan, what is called an MAPD. It's built into a Medicare Advantage HMO or a PPO, and you cannot purchase a separate Part D plan and a bundled HMO or a PPO at the same time. One will cancel the other one out. Medicare Advantage plans do not always include prescription drugs. So you have to make sure to get a prescription drug plan that includes medications if you're wanting medication coverage. And then some military retiree plans offer prescription coverage considered credible coverage, and they're able to have VA and Medicare prescription drug plan if they are a VA credible member. Okay. Next slide. Number 26. Part D eligibility and premium. Okay. Must be enrolled in Medicare A and B. Plan must be offered in your area. No underwriting at all. So if you want to get a prescription drug plan, it's very easy to do so. Monthly premium, the Part D monthly premium varies by plan depending on which you choose to join. However, if you have a higher income and join a Part D plan, an income-related monthly adjustment amount, IRMA, will be deducted from Social Security from your SSI check in addition to Part D premium. So unfortunately, If you have a higher income, Uncle Sam is going to tax you. You're going to pay more for a prescription drug plan. Very small select few of individuals have to deal with that. Most standard folks do not. But if you have a higher income, they will charge you more to get a Part D plan. And as you can see, if you have a higher income for the Part D plan, most folks, there's the numbers there on income. Most folks just pay the plan premium. But if you have a higher income, as you can see on the bracket, they'll tax you based on whatever bracket number you're falling under. But again, most folks just pay the standard premium. They don't have to worry about a high income. Okay. Next page, 28. So Medicaid services card, Medicaid and Part D assistance. So somebody can have Medicaid, dual eligible, which is Medicare and Medicaid. That's what a dual eligible means. Is for somebody who has Medicaid and has Medicare. Other partial levels of Medicaid do exist, and they have reduced copayments, coinsurance premiums. And then contact your local Medicaid office if you feel assistance is needed. So in Washington, they call it a services card. In Texas, I'm not sure what they call it. Probably just Medicaid card. I don't know. But you could also have Part D assistance. Part D assistance is for your medications. That is for low income subsidy. It equals LIS. That's what that means. Also extra. It's also called extra help. Reduce copayments, coinsurance, and premiums and drug cost. You should contact Social Security at 1-800-772-1213. And that is for somebody, if you hear somebody say, my medications are very expensive, I cannot afford them, I got to choose between my meds and paid rent. If you hear somebody saying that, you should tell them, hey, you know what? You should probably call Social Security, and there's that number, and tell them, hey, I think I qualify for extra help on my medicines. And this really helps a lot of folks who need the extra help on paying their medications. A lot of times people don't know they qualify and they're surprised to call Social Security. It takes maybe 5 minutes to do this application, and you'll get a notice in the mail if you get approved. But a lot of folks do not know about this benefit and should be calling Social Security to see if they qualify for extra help on their medications. Okay. 29, next slide, you guys. So we're going to go ahead and talk about Part C and D enrollment periods. So the first one is we have an IEP, initial enrollment period. What is that? So that is when you first become eligible for Medicare Part A and B, usually your 65th birthday, you're eligible to enroll in a Medicare Advantage plan or a prescription drug plan. This enrollment period is 3 months before your birthday, the month of your birthday, and 3 months after. So that is what is an IEP, initial enrollment period. Now we have your annual election period, very busy time for me. So that's from October 15th to December 7th. You may add, drop, or switch a Medicare Advantage plan or a Part D plan annually. So at that time, folks call us and we can shop around for a different prescription drug plan or maybe a different Medicare Advantage plan. The last application Medicare receives by December 7th will provide coverage effective January 1st. Next slide. So Part C and D enrollment periods. We have a special enrollment period, also known as an SCP. There are enrollment periods based on special circumstances where someone can enroll in a plan outside of the AEP. Some but not all situations resulting in an SCP include change of residence. So if somebody moves different county, different state, they have an SCP. Involuntary loss of credible drug coverage. So somebody who loses an employee plan, they're no longer working, maybe got laid off, now they need Medicare and a Part D plan, that will give them an SCP. Exceptional conditions such as gaining or losing Medicaid eligibility or Part D low-income subsidy, changing employer or union group coverage, Medicare Advantage coverage, enrollment based on incorrect or misleading information, excuse me, non-U.S. citizens who become lawfully present in the United States, individuals who dropped a Medigap policy when they enrolled for the first time in a Medicare Advantage plan and who are still in a trial period, and individuals with severe disabling conditions who wish to enroll in SNP, Special Needs Plan. All right, next page. So we have Part C and D enrollment periods. We have Medicare Open Enrollment Period, also known as OEP, and this is going on now, January 1st to March 31st. Somebody can switch to a different Medicare Advantage plan if they want. They can drop your current Medicare Advantage plan and return to original Medicare A and B. They can sign up for a standalone Part D prescription drug plan if they return to original Medicare, or you can enroll in a supplement plan as well, but medical underwriting may be required. Okay, that's what a OEP stands for. Okay, Medicare Advantage Open Enrollment Period. Next slide, number 32. Employer-sponsored retiree plans. Retirees are usually provided with information at retirement through their human resources department or benefits administrator. Retirement plans may include Medicare Supplement or Medicare Advantage options. Retirees should verify their providers accept the retiree plan offered. Plans may include credible drug coverage. You will receive a letter advising you if your plan has credible coverage to Part D. It is important to keep this letter as you may need it in the future. Next slide, number 33, Part C and D quality of plans. So Medicare program grades all health prescription drug coverage plans each year on overall performance based on member satisfaction surveys, healthcare provider data. This overall rating is called the star rating. Examples of the areas covered by this rating include how well the plan manages members with critical illness, how members rate their plan's service and care, how plans and their providers engage members in using preventative care. So as you can see, excellent is 5-star, above average is a 4-star, average is a 3-star, and below average is a 2, and then poor is a 1-star rating. Next slide. So Medicare plan selection pointers. Here's some pointers for you guys. Is your plan selected? The plan that you selected accepted by your physicians or specialists? That's very important to note. You always want to make sure that your doctor is in the plan's network. Does your selected plan meet your personal and financial needs? Also very important. Should you choose to travel, will the plan provide adequate coverage? Do you understand the prescription drug formulary? Does the plan cover your medications? Also very important. Not all plans cover all medications the same, so it's always very important to check the formulary to see if your medication you're taking is covered. Next slide, number 35. When you're selecting an agent, we have some agent selection pointers. Are they independent and represent more than one company? Do they only represent a single insurance carrier? So like myself, I'm a broker. I don't represent just one carrier. I sell multiple plans, multiple carriers. Okay, so you always want to make sure that whoever you're working with, that they are unbiased, meaning do they represent more than one carrier? Okay, and then it's also important to recognize, do you specialize in Medicare? I myself, that is what we do. That is their specialty there. And do they work with your physician to make sure the coverage you choose is the one that they accept? So also very important, the plan that you chose, is it accepted by your doctor? Last thing you want to do is get a policy and then your doctor does not accept it when you go see them. So we are here done with our presentation. We have everything that's provided to you guys. I have some resources and contact information if you guys need the phone number to Medicare. Here it is. Social Security number, and then Vibrant USA. You can call me. I do have a local number, but my main number is 866-733-5111. Again, we're your Medicare insurance plan specialist, assist you in every step of the way, from a needs assessment to plan comparison and enrollment at no cost to anybody. And we have continued service year round. And that's our presentation, you guys.